All this year, we're spotlighting leaders at the top of their fields, innovators and mentors inspiring us in a variety of industries. Today, we turn to healthcare. Dr. Luv Hijirawala is a board-certified colorectal and general surgeon with AdventHealth. He specializes in the full spectrum of colorectal care and advanced robotic surgeries. In fact, he is recognized as a surgeon of excellence in robotic surgery by the Surgical Review Corporation. That's a nonprofit that's administering best-in-class accreditation programs for medical professionals worldwide. We are so happy to have him in the studio with us. Doctor, thank you so much for coming in.
Thank you so much for inviting me to talk about the topic that's very near and dear to my heart.
Let's talk about that trend. Colon cancer is something that most people think about is a disease for old people, and the trends don't show that.
Yeah, so colon cancer is traditionally thought to be a disease that increases with age, and I think we've made tremendous strides in finding it early and almost decreasing the incidence of it with the use of colonoscopy and preventing the disease. Now, we have seen a trend recently in patients who are younger than the screening age, particularly patients who are younger than 50 years age and millennials, right? And we're seeing a rise in the colon cancer in this population, and which is, it's been more prevalent in the last, 5 to 10 years.
What are some of the statistics that you would say, that you said where more young people are getting this?
Yeah, so currently, out of all the colorectal cancer, 20% of that occurs in patients who are younger than 50 years old. And that is, completely new, and that used to be 11%, 15, 20 years ago, and that has increased now.
To what can we attribute this trend to? Is it the diet? Is it what we're drinking? Is it environmental?
There are a lot of links, but there's no particular causative relationship to what we call the modifiable risk factors. So some things that are, associated with risk of colon cancer is ultra-processed meats, high protein, high red meat intake, alcohol consumption, smoking, and some of the protective effects are given by fiber. But there's not a particular causative relationship. So, rather than blaming one particular item, I would focus on a healthy, balanced diet that has, protein, fiber, carbs, and all the nutrients. And
that's certainly a message that we heard after the death of 47-year-old James Vanderbeek, who is the actor who died from Dawson's Creek. Also 43-year-old Chadwick Boseman, known as the Black Panther, when he died in 2020. Both of them said that they did not recognize that the bowel movement changes that they were experiencing were the early signs. They just thought they were having too much coffee. Yeah. And so you're helping to raise awareness. Tell us about your Tampa Bay story. Why Tampa to practice your profession?
Tampa Bay is amazing. So, I've spent some time all over Florida. My parents live in South Florida. I've trained in Miami, Georgetown, LSU, but I went to USF here and fell in love with Tampa Bay. We have an incredible community. It's very diverse, and what I've found in the last few years of practicing here is that everybody's really focused on a healthy lifestyle and wants to do better. So it's great to have this community around me.
Thank you so much, and congratulations on all of your successes.
Thank you.
We are very proud at WEDU to sponsor the community conversations on colon cancer that are happening on March the 11th. They're being hosted by AdventHealth and the Tampa Bay Times. The event is free and it's open to the public, so don't miss Colon Cancer on the Rise, what Tampa Bay needs to know.